Hi, my name's Emily and I'm the Health and Wellness Coordinator.
And my name's Heather. I am the nurse here. We are going to be doing a med-aid training video for you guys, and we're basically going to be going over the basic competencies and procedures and things specific to our facilities.
Okay. What is a med-aid? So the purpose of this position is to provide a safe way for individuals other than licensed healthcare professionals to administer medications.
And the different ways that med-aids can give medications are orally, inhalation, which is inhalers, nebulizer, oxygen, eye drops, nose, ears, and then topical such as lotions and creams.
All right, medication storage is a locked room or closet. It can include the individual bins, locked bins for controlled substances, or the refrigerators that keep meds that need to be refrigerated. Please note that each facility will have different areas for designated med storage. So this is our med room, which is locked at all times. Each client has their own medication bin. Note that different packaging for medications can include unit dose, which is individual dose packaging, or multiple dose, which is a pill bottle. Most pharmacists use, or most commonly use, the bottles. Disposal of medications, there are labeled bins at each facility, labeled med disposal. Controlled substances are locked in a safe or a locked bin. Control record needs to be filled out each time that the medication is given. When discontinued or no longer taking, please let the health or wellness coordinator know, or the nurse, so that the medication may be disposed of properly.
The next thing we'll be discussing is hygiene. We'll start with gloves, when to wear those. If you're going to be applying any topical creams or lotions, or if you're going to be coming into contact with any body fluids, you'd want to be wearing gloves. I will show you the correct procedure on how to take those off right now. So I've already got my gloves on. You're going to take and grab, pinch the glove in the middle, and you're just going to pull, kind of making it come inside out, and then you'll squeeze it into this hand, and you'll come underneath the glove on the other side, and you'll just pull it off, and you can dispose of. Hand washing, soap and water is obviously preferred, but sanitizer should be in most areas that you can use sanitizer. You'll want to hand wash or use sanitizer at the beginning end of your shift, in between residents or in between giving medications, after coughing, sneezing, after using the restroom, before and after eating, or with your breaks. I will demonstrate now how to wash your hands. You're going to want to make sure you have all of your supplies, water, soap, and paper towels. You're just going to want to turn on the water. With hand washing, you're going to want to make sure that your hands are faced down the entire time. Get some soap. You're going to want to make sure that you're doing all surface areas of your hands, even up into your wrists. And they usually say about 20 seconds, or as long as it takes to sing the alphabet or sing happy birthday. And when you rinse, typically you want to come from the wrists and go down to your hands, fingers, letting that drip off. Get your paper towel. Dry everything. Get a clean paper towel and shut off the sink. The next thing we're going to discuss, you're going to hear this a lot, is the 5 rights. I'll discuss it now, but then later when we're discussing things, we'll probably just say the 5 rights and you'll refer back to this. But the 5 rights of medications are that you're giving it to the right person, that it's the right medication, the right dose, the right time, and the right route. When someone comes to take their medication, you're always going to want to identify the person. Here at DDP, there are pictures of each client in their binder that can help identify. Otherwise, just asking their name is a way to identify them. Next up, in your packets, there's going to be papers that look like this. It's got abbreviations, and it also goes over the measurements of medications. For example, HS, you're going to see that just means bedtime. You're going to see things like BID, which is twice a day. QID could be 4 times a day. MG, milligrams, those are some common abbreviations that you're going to see here in our facility. Medication administration, there's 3 components to that, and those are the 5 rights that I just discussed. Recording the medication provision, which is documentation in our EMR. That's our computer charting that we use here. And then after you give a medication, you're going to want to observe the desired effect and monitor and report any side effects. Some common actions or common effects of medications are that you're going to want to get pain relief, relieve anxiety, assist with sleeping, replace missing or low chemicals in the body. And some common side effects that we see with any medication is headaches, nausea, vomiting, constipation, diarrhea, rash, itching. I think I already said headaches, but those are some common side effects. The next thing I'm going to discuss is provision of medications. I had said earlier the different ways that medication or med aids can give medications. The first being oral. Those would be tablets, capsules that you can just swallow with water. Occasionally those can be cut in half or crushed and put into, say, applesauce if someone has difficulty swallowing. We'll let you know if that's something that can be done, because there are some medications that can't be crushed or cut in half, and those are usually like your extended release medications. The next kind that med aids can do is topical, and those are your lotions, ointments, transdermal. Some of those include like the nicotine patch, that's a transdermal patch. Things like Icy Hot, Neosporin, those are your ointments. And you'll want to make sure that you use gloves, especially when applying those, because you're coming into contact with the client's skin. Some lingual or buccal medications, you place those under the tongue or between the cheek and gum and allow those to dissolve. Usually you want to make sure that the resident stays in here, and it can take even up to 10 to 15 minutes for those to dissolve. And you'll want to make sure when you're giving medications that you do a mouth check to make sure that the medication is not anywhere still in their mouth. Next up are eye drops. When administering those, you'll want to make sure that their head is tilted back, that you'll pull down on the lower lid. And when you instill that drop, make sure they close their eye and kind of move their eye around to help move that medication around. And if they have more than one eye drop medication, you'll want to make sure to wait 5 minutes between doses on those. Next up are ear drops. You'll want to make sure that you pull the ear up and back. And if you have their head tilted when you give that in, make sure that they remain in that position for 5 minutes after instilling that medication. Next up are nose medications. A lot of a common medication that our clients take is Flonase for allergies, that they're just going to want to insert it into their nares, kind of to the up and outside, and take a sniff while they're instilling that medication. Usually you push down on that. Inhalers, that would be like albuterol, Symbicort, things like that. You're going to want to make sure that they inhale as they're pressing down on that medication, hold their breath for 10 seconds or more, and they can rinse their mouth out immediately after taking that if they need to. Just make sure that they rinse and spit. We do have occasional people on nebulizers, and that typically they come in with their own machine, or that would come from the pharmacy. The medication would just be placed in the chamber and connect the mouthpiece and connector, and they would take that medication until it's gone. It's usually 10 to 15 minutes, and make sure to rinse that after use. If we ever have anyone on a nebulizer, you'll kind of be instructed on how to use that. Oxygen is also something that med aids can administer. It's rare here, but we have had it. Usually the oxygen tank is here. You just attach the tubing. There's a flow rate on there that you can adjust that rate. It goes up to 10 liters. Typically, if anybody's on it, it's 1 to 2 liters. And again, if we have anyone on that, we would instruct on use of that. The next thing we'll discuss is preparation of medication provision. With each resident, you'll want to make sure to shut the door, as this provides for less distractions. Prior to giving medications, you'll want to make sure to sanitize with hand sanitizer or washing your hands. There are 3 safety checks prior to administering medications. I'll go over these right now. These are getting the medication out and comparing the label with the EMR. While doing this, you're going to want to check for the correct name of the medication, dose, route, resident, and time. Unfortunately, in our EMR, we don't have allergies that can be seen, so we have each bin labeled with red labels that discuss the allergies. NKA stands for no known allergies. At this time, you'll want to do a second safety check, checking the label again for correct name of medication, dose, route, resident, and time. Once those are done, you'll open and pour the medication into the cup without touching. Unfortunately, our labels don't always match the EMR as med changes are made with the provider. You'll always want to check orders. We have a binder in the med room that has current med orders. If there's any question, you can always ask the health and wellness coordinator or the nurse if unsure. At this time, you'll want to give the medication and do a mouth check to check that they were taking the medication and not cheeking it. You'll return the medication to the bin.
The next section that we will be discussing are medication errors. Examples of a medication error could be not giving a medication when scheduled, incorrect documentation, giving an incorrect dose, giving the wrong medication, or giving the medication through the wrong route. Follow the order exactly. If there's any questions, you can always ask the health and wellness coordinator or the nurse. When you have a medication error, it is important that you admit this right away. Report to the health and wellness coordinator, fill out the correct form, the medication error report. Report to the health and wellness coordinator and the nurse, and we will follow up. In this next section, we'll be talking about resident rights. These include the right to refuse medication. It is important to document and report to health and wellness coordinator. Each resident has a right to confidentiality. We do not share information with other residents. Only staff or supervisor, health and wellness coordinator or nurse, and do not share any information with family or friends. Neglect and abuse must always be immediately reported to the supervisor. Examples of neglect include not following supervisor's directions, not following policy or procedure. Examples of abuse can include physical, mental, emotional, sexual, verbal, using residents' property, damaging or theft of resident property. In this section, we're talking about staff administration versus self-administration. Staff administration means that med aides will provide the medication to the client. Self-administration is where the client is capable of setting up their own medications and taking them themselves. Each week, they meet with the health and wellness coordinator to set up their medications in a pill organizer. They are also, if approved by their counselor, may check out their medications to take with them on outings. We just need to note the name, dose, and frequency of each medication. Some additional important information that we would like you to know about is that individuals with diabetes are considered self-administration when it comes to taking their insulin and testing their blood sugars. We have a sharps container in each med room. Counting medications in, we have a logbook, so when they come in from the pharmacy, med aides are required to note the client's name, the med dose, amount, date, and their staff's initials. PRNs are also located, or over-the-counters are located in our organizer. We have Tylenol, ibuprofen, and quite a lot of different over-the-counter medications located here. It's important that you are documenting in the EMR and noting the time in between when they have last taken a dose.
We're going to discuss vital signs next. That includes temperature, blood pressure, pulse, and respirations, but we'll not discuss respirations today. The machine we have here at DDP looks like this. At the other facilities, it's a more compact, but they do the same thing. Different blood pressure cuff sizes. You're going to want to make sure that you're using the right size for the right client. This one is a little too large, so we will use the smaller one. With this one, you just pinch, and you can see that it just goes on here. You're going to pinch and push it on, you'll feel it click. And you want to make sure there's an arrow on here that goes to the artery. You can see the inside of their arm. You're going to put that on nice and snug. And on this machine, the button to turn it on is there. And once it gets warmed up, we'll just push the button here to start it. Now, when you're checking a blood pressure, you're not going to want to engage the client in any conversation because them talking can cause their blood pressure actually to increase. We've got a couple different blood, temperature things here. We've got just the old-fashioned oral, and that you just pull out, put a cover on it, insert it under their tongue, and wait for it to read. Otherwise, we've got the forehead ones. You just push the button and it'll read. You'll hold it about a ½ inch away from their head. Her temperature is 97.3. Normal pulse is 60 to 100. Her blood pressure right now is 124/75. Normal is 120/80. Anything over 150 to 100, 150/100, you'll want to contact the health and wellness coordinator or myself, the nurse. Heart rate normal is 60 to 100, like I said. Anything above 110, you'll want to contact the health and wellness coordinator or the nurse. There are some medications that require blood pressure to be checked prior to giving. That will be on the EMR letting you know when to do that, and if there's any parameters such as do not give a medication if it's below 90/60.